Good morning, Jeff.
Hi, buddy.
How are you?
How you doing?
It's good to see you.
What's going on?
Not much. Thanks for doing this.
Absolutely.
So appreciative.
Absolutely, this is great.
I'm Grace Harner, and we're happy to bring you this new episode and take you through the perspective of two powerhouses in the medical real estate industry. David Vitka from Catholic Health and Liz Kauffman-Dence from Rochester Regional Health will take you through their exciting news they have to share on their experience in the medical sector. Alrighty, welcome. Thank you so much for joining us today. If you wouldn't mind, could you introduce yourself and tell us a little bit about your role and your practice?
Okay. So I'm Liz Kauffman-Dence, Rochester Regional Health, Director of Real Estate Property Management. Sort of transitioning, I'm going to take a little break for a few weeks, but I handle all of the leasing, all of the property management, and the Certificate of Needs to New York State for the entire system.
And I'm David Vitka. I work at Catholic Health. I've been there 24 years, and that's located here in Buffalo, of course. I am VP of Facility Planning, Design, and Construction, and I'm attached to real estate through a dotted line with legal, so we share the property management, real estate guidance in a partnership, and that's what I do.
Lovely. And you said you know each other from previous work, or
Yeah,
tell
we
me?
met on a
gosh.
nice day in 2017, I think.
Yes, we did. We had a wonderful conversation for like 2.5 hours, and probably could have continued for hours.
Yeah, so
Yeah.
it's really wonderful to meet up again.
Yeah.
Awesome. So most people probably don't realize how different medical real estate is from traditional office space. So what makes it more complicated or unique?
Go ahead, David.
Well, I think it's highly competitive, number one. It's highly specific. And what we're looking for more than anything are efficiencies in this new world order that we're all faced with moving forward. I think we probably both have a tremendous amount of real estate. Catholic Health, I can speak for, has acquired many practices since 2016, up to 60 of them. And we have a whole smorgasbord of real estate that came with those transitions to being part of Catholic Health through our captive BC called Trinity Medical. And the buildings are in a state of all different kinds of condition. They don't follow the system's brand yet unless we create that capital to transform them. But I think more than anything, we're trying to create efficiencies through multi-specialty practices in the outpatient world that allow us to not have multiple leadership departments in all 100 different locations that we have to manage without a real estate or without a maintenance department like a hospital would have. So we're looking for those efficiencies. It's very complex, it's very dynamic, and it involves also placement in the community is very important based upon your competitors as well.
Right. So you're essentially, doing a lot of work studying the region and the area's needs, and then
Right.
obviously you're, on par with the industry trends with that more campus-like feel.
Exactly.
So how has that been so far, kind of transitioning to that campus-like style?
It's a lot. We actually engaged with Newmark and Ciminelli as for extra help because probably like Liz's world, we have a very, very lean team. We are viewed as overhead no matter what we think. I am a part of the healing process, as is Liz, in many different ways. We call them ministries at Catholic Health, and I think that I take that really seriously. But I just think it's a dynamic environment, and the comorbidities that are out there in the different regions matter too to us. Not only there's the competitors, but aging practices that are out there that aren't a part of us but are aligned with us through our independent practice organization called Catholic Medical Partners. We want them to refer to us in outpatient settings or hospital settings, and a lot of it ends up being about reimbursement and achieving the lowest cost on the patient, but also the highest revenue for us. And there's a gentle balance there with co-pays versus in a hospital versus setting versus an outpatient setting. So. lots going on there.
Yes, for sure. And I'm glad that we could, ease that.
Hey, right? I believe that the medical real estate is exactly that. We tend to bring in private physicians who are either aging out or are, they realize they can't run a practice on their own anymore. So they reach out to us and we acquire them. So we acquire their covered lives, and then we get their lovely leases or we get their lovely owned property.
Great
And
point.
right.
You're
And so
inheriting.
right. So we get that, and then all of a sudden we have 11, 1,000 square foot practices that become very difficult to manage. And we are and I don't know if you've picked up on this yet, but healthcare is very slow moving. So if a lease or an owned property is up for sale, it takes us a long time to make a decision. And that's because we have to take all of this information into account. If we were just a real estate world, we'd buy, sell, move, lease all we could in short order. Now, we have to wait. Are we infringing upon our competitor? Is the state going to yell at us for doing this? So it does take a long time, and it's really helpful when we have partners in the community that help us forecast it out, right?
Yep.
And then we can say, no, we can't go there. Catholic Health is there. That's not our territory. Or, you know what? Catholic Health has sort of started to ignore this territory. Should we come in? So it's very strategic, and that's why our wheel is slow.
Yep. In addition to governance,
Yes,
board
true.
approvals, and those kinds of things. So you
Right.
have to stay way out ahead of it. And then when it is a hospital-based something that you're building, the CON process is has an unknown trajectory sometimes. Sometimes it's
Sometimes.
faster than others.
Yes, this is very true.
Yeah, so there's a lot to it, and losing the opportunity for that piece of real estate is a really real thing. So we look to folks like you to help us not only do
Right.
the GIS mapping, but do the brokerage, in our case at Catholic Health, the property management for all these offsites, whether it's a full PM or partial. You're helping us as developer in some ways so far, and we're cutting our teeth with owner's rep assignments now on our very first project with y'all. And because, you'd probably be surprised, I have a staff for, a giant organization of 10 people trying to serve the whole organization, and it's brutal. So you guys are helping us.
Right.
Yeah. So I guess let's dive a little bit deeper into why that is so important to bring in a broker or a property manager to help with all of those pieces to put the puzzle together.
It's very we're expensive. Our departments are very expensive. We tend to we run lean because we are expensive. They always joke, "Oh, Liz is in the room. It's going to cost us $100,000."
Same here.
Right, right. Oh, she's going to tell us we need an air handler, and because we do, we always need something. So we're not revenue generating; we're revenue spending. So a broker and a property manager coming in to help us is wonderful because one tech for Ciminelli can manage 5 or 6 sites, and I don't have to pay. This is bad, but I don't have to pay their retirement, their benefit, their insurances, and they don't always have to report there. If they're my employee, I have to assume all of that, and I may not need them at those 10 sites every week.
Right.
But Ciminelli has that tech that has my 10 sites and 5 for Catholic Health and UB and everybody else. And so it becomes a very cost-effective way to get our work done. And brokers, I don't necessarily use a broker. Very often we do a lot of our internal negotiations ourselves, but having a brokerage house behind me is always helpful to find that space.
Do you have some examples on how that kind of impacted I gotta re-say that this question. Do you have a few examples on how that directly impacted your operations or even your patient experience?
Sure, I have a project that you're helping us in 3 or 4 of those ways. I talked about before, and we're using your broker, who found us the location, and it's an ideal location for us. And we're also, he was able to negotiate a tremendous amount of tenant improvement allowance on this particular multi-specialty project that we probably didn't have these. We have a great attorney that heads up real estate, but we don't do this every day, all the time, and to have that extra expertise negotiating along with us, for us, with the landlord, got us to a point where, with very, very limited capital available, because we got a big portfolio and the hospitals consume the majority of the capital that we have available through reimbursement. And with 2027 being a pivotal year with the big bill, things are going to change reimbursement-wise. We have to really stay on that and be as efficient as we can. And I think the broker that we used really, really helped us with this project that we're coming out of the box with.
Yeah.
And so.
So if another medical practice called you, say tomorrow, and they asked for some advice, what advice would you give them if they were considering a move?
Time. Give yourself time. There's always the unknown, right? It's a slow move, and to look outside the box, right? We Rochester Regional has become pretty famous in the Western region for converting old Tops markets, Wegmans grocery stores, malls into healthcare. Even Strong in the U of R has done the same thing with a mall in Rochester. But I would tell that medical practice, if they really wanted to move, give themselves time to think about what they really need, how they want to make the move. Is it a splash? Is it quiet? And think outside the box. Where else can you go? Where are your patients? What's easy for them to get to you? And not necessarily easy for your physician or staff to get to you, but how do your patients get to you and find you?
I would echo that same sentiment for all of this. For the project that I was just talking about, you got me thinking that we are actually folding in 3 practices into this one site, and it is a former strip mall, Rite Aid City, because their Rite Aids were always in the right location, right, for at least our suburban markets. And it's going to be a multi-specialty experience, so there's a ton of stakeholders then, because not just multiple sites coming to one, but when you do multi-specialty, there's sharing that's going to be involved. And in the old world order in medical practices, the doctors had their own offices with their diplomas up in the walls, and that kind of thing, and that still exists in many of our practices, and they're going to be transitioning now to sharing and touchdown areas and those kinds of things. So we're finding it even more complex internally, that when we transition from, just say private practices that are like cardiology's by itself, and now they're going to be with vascular and cardiology and primary care and endocrinology, that you've got a ton more stakeholders to satisfy.
Right.
And they're our clients, right?
Yeah. But it makes it so much easier for the patient. If I'm at my primary care physician and he says, there's a little bit of a issue with your heart here, hey, wait, my cardiology friends are right here, or my vascular friends. So it really becomes a destination for the patient. I can take my kids to the dentist, their pediatrician, and get my husband's x-ray all on one day. I can schedule everything.
Oh,
I don't
that's
have to
always
come.
the best.
Yeah, right? So you
Go next door for your blood draw.
Yeah, so everything is right there. And there is economies to scale there, right? You're learning that now, but we started our destination campuses in about 2015, and there's economy of scale with how you greet your patients, right? How do you don't, go over there and see Sue, and then you go over there and see Mike. You go to one person, and then you wait to be called back, so it's a great setup. It really is nice.
Do you feel like that adaptive reuse and that destination-like feel is the future of medical office space?
I do.
I do too.
I do, right? Yeah. I think adaptive use of Rite Aids, right? I mean, there's a vacant Rite Aid every 3 miles right now,
sure.
And they should be looked at for other things too, not just medical care, right? But I think that Rite Aid had the right plan. They knew where to go. They had a great marketing team. Not as good as you guys, but they knew where to go. They knew where to land, and they were busy. But I do think multi-specialty out of the hospital care is going to be on everybody's front door in the next probably 5 years, I would think.
I admired so much when I visited you, and I saw the decanting of the Rochester general campus to that mall nearby. That was really on the forefront back then. And I think also, like, banking was way ahead of healthcare, 20 years ago when the ATMs were coming around and making things, and we have to make access to our care that available, that wonderful, if you could say it. And the other thing that we didn't touch on today is our brand, marketing our brand. So Catholic Health, unlike our main competitors here in Buffalo, never became yet a full asset merger. So we have like 20-something companies open, and each hospital is different. It becomes really logistically a nightmare, even to float nurses between facilities because they have a different employer. So I'm looking forward to the day that the full asset merger does come, like it did for the other organizations, because it will allow us to be even more nimble than all the maneuvering we have to do. So
That's exciting.
yeah, it's exciting.
Yeah, it is. It's a difficult journey, but once the asset merger happens, it almost is like, it really is just a deep sign. You're like, okay, now we can really start planning.
Right, because right now we're just putting a sign on a building for us is very complex. We are trying to promote the Catholic Health brand. We have nursing homes that are called Father Baker Manor, the Macaulay residence, and people say all the time, "Is that part of Catholic Health?" And so now we're co-branding our signs to have that, or in the case that it's the private practice model with Trinity, we may have, if we have a Catholic Health lease overarching this new Rite Aid and more building in the strip mall, we found out legally it's important to do it the right way, so that you don't confuse the public, but also that you're regulatorily doing it properly. But if we have a Catholic Health lease over that building, we can brand it Catholic Health and co-brand it with a Trinity as well. So we're trying to get that connection. And our legal department has let us do our Sales and Crosses logo for Catholic Health on both entities. So that's a cue in your mind that says, oh, Catholic Health. So we're trying to take it a step further. It's very complicated, and you got to make sure that your shop drawings are really well done for the signage, because you could really make a mistake and then build the wrong thing.
Yeah. Okay. Anything specifically right now that you would like to touch on that we missed so far?
I think if I can
go for it.
Nimbleness amongst the time that's needed, but the nimbleness and flexibility in that adaptive reuse is something we're really interested with. I have been so interested in modular and prefab for the insides of the buildings, the outsides. When we built the new micro hospital or the neighborhood hospital in Lockport, we were really interested. Are we there yet? Can we do modular or exam rooms, that kind of thing, for the outpatient areas? And all we were able to do was a mechanical room that was modular and racks for all the HVAC. We weren't there then yet, but now I'm very interested on the ambulatory side and MOBs in these touchdown areas I was talking to. There's pods. I don't know if you guys, have
we should
do a lot of that, but
recording. But there's a lot of things that we could talk
to reconfigure easily, even though it might be first cost might be a little bit more expensive. There's speed to market, that there's a helper there, and then there's reconfigurability. So I'd like to just mention that to the public, that's a journey right now, and it's kind of like when you buy a car, you're waiting for that next model to come out. Did they do better? And what the doctors are telling us is acoustics are everything. We can't hear sound between the rooms. So anyway, that's that.
Yeah, and in the modular world, and it's funny, two things. Look at me, I'll just chat. The modular world is very interesting because Rochester Regional started this path, years ago, back in 15, of the onstage, offstage, right?
Yep, that's
and loved the onstage, offstage. Then we found out that the building of that was costing 20 to 30% more to build that than the traditional double-loaded corridor of exam rooms. And then it became, what does that community like? Our city, more populous areas, like the onstage, offstage, it's a little bit more techy. It's a little bit more quick in, out, where rural health really didn't like that because they want to feel like they're in a medical practice. So we've been looking at the cost advantages of that and finding that we can modulize the old method, but not the new method, not the on-stage, off-stage. So it's been really interesting. One of the other things that I've had a conversation with a different real estate firm just recently was having dedicated medical knowledge with the realtors. You know, most of the realtors either come up through that commercial channel, right? And they understand retail leases, mall leases, they got it down, right? They got fast food down. And then you have the people that come up through residential, right? And they can sell you a townhouse with no problem and have an open house on a Thursday. But what there isn't a specialized is that medical, right? You call the big brokers and you ask, who can help me find medical practices? And all of a sudden you're getting manufacturing, so I think somewhere in the future there might be somewhere that real estate could get like a little niche.
I could absolutely see that. I mean, even
Right?
just we've been seeing it growing so much here. There's so much conversation around it, and there's a lot to be learned and a lot of room to grow in the real estate industry within the medical sector.
And that industry has to, like you all, have to be patient with us owners because we move slow. It's turning the ship takes a really long time.
Yeah, it's a little slower than a snail.
Totally agree.
So on-stage, off-stage is really to keep the inner workings of a clinic off-stage. So the nurse's station, the doctor's offices, the lab testing rooms, the storage rooms, all of those are kind of protected in a way from the exam room. You would walk down a normal corridor, and a lot of times it's barn door. So the doors slide, and the patient and whoever's rooming them goes into the exam room. And then there's another door in there, and that door actually leads you into the service area or where the doctors, nurses congregate, where the lab testing is, where dirty, clean, soiled rooms are. And the patient never sees that, and they can have conversations without the patient's hearing it, is even more importantly. So if you and I are discussing a patient, there's patients walking down the corridor and nobody's hearing it. It's already on the other side. And essentially it becomes a little bit more of an expensive build because you're putting two doors on. You're kind of duplicating things. You're duplicating another corridor. It's more square footage. But it does create a quicker rooming, cleaning process.
Efficiencies.
Yeah.
Yeah, think about I don't know if they invented it, but I always think about Disney World, right? Mm-hmm. Many of us have been there, and there's that whole underworld, and they coined the term on-stage, off-stage years ago, and like I said, with banking and everything else, we're falling slowly behind, but we're there now, and it's all about the patient experience and the efficiencies behind for the staff to.
That is so interesting.
Yeah, I mean, they can stock the room while there's patients in it because the backup of the cabinets opens up to the offstage. So they're stocking without having to interrupt care at all. Wow. Yeah.
So what would you say the biggest, well, not necessarily the biggest, but just one that comes to mind, issues that you're having in that process of from start to finish, maybe even something that caused some problems 5 years ago that might not today?
My biggest issue, I don't even have to wait to answer or think about it too long. My biggest issue right now is that, and I don't know if it's because of hybrid work, remote, or whatever, but the teams that we create to actually build the spaces, and it's not so much getting the lease and all that, but when we get to the schematic design development, construction documents and construction, administration, all the phases of a project. The team has to be in sync, and we are trusting our consultants because of our limited staff to make sure that what's on those drawings is all included.
Yeah.
We didn't forget pumps, which I heard yesterday happened on one of our projects at one of our hospitals. And even after commissioning, we have to make sure that our AE and construction teams actually get us what we are paying for.
Yeah.
That's
Yeah, I would
that's my
agree with
number
that.
one
Yeah.
issue. I've seen a decline in that, and I think it may be because, a lot of offices are working from home or working across the country from each other,
Right.
We haven't done many out-of-town architects at Catholic
Okay.
Health, but we're trying right now, and we have a New York-based architect that's helping us. It's going tremendously, but it's involving a lot of touch points with not only their personal visits here, but a lot of Teams meetings.
Yeah, I agree with that. I mean, I think there becomes we've lost something.
We've lost some.
And when we do build outs, I'll tell you, Ciminelli helped us. We just did a 57,000 square foot practice destination campus down in Geneva, and they were wonderful. They jumped in as we were finishing out that project. They did walkthroughs. They helped us, this is what it said was going to be on the drawing, and it's not there yet, So it was really helpful to that, but the development team should have done it, not my property management team. But my property management team was great on that double check, and it's almost like we depended on them and not who we should have depended on, right? Who I paid to depend on, right? And, I almost had to pay for it twice kind of thing. But I think that ownership and responsibility thing is,
Yep.
yeah, definitely.
Yeah, and we need that kind of
Yeah.
tight project in order to survive, and that's why, I'm reaching out to y'all for the owner representation now, so I can have more eyes in the field, more days of the week than my one regional director and two project managers in that region could handle.
Yeah.
We need the help.
Right. That must have been such a huge relief. Would you mind expanding on that just a little bit?
Well, just, I guess more, we don't have, with our lean staff, the amount of people to actually watch over our projects and do them as well as we know we can. If I had one project a year, and even if a big one, I'd be able to concentrate on it. But the truth of the matter is, I think we hit 360 project numbers last year for my 11 people, 10 to 11 people total, including me, it's 11. And some of them are the ankle biters, because we do the FF&E, the
Yep.
purchases, the nurse station chairs and those kinds of things. So we procure through facility planning as well. So take 100 off of that, and I still have 200 plus projects that are most medium, and then you got the signature projects on top of that are the big projects. So that's my expansion of that, is we just basically need more help in-house, and we need a tight team and a better way to manage.
Absolutely.
Yeah, I think it's definitely, so my feet always land in construction and real estate. They go hand in hand all the time. And I did come up through the construction world, so we have those signature projects. We just finished a $130 million expansion at our GH. I think
we
you
got
might have
the
seen
tour
us
of it.
breaking ground,
Yep.
So it really is that, goes back to we are very lean. And nobody knows project management, right? You have to learn project management. You just can't jump in, hire them off the street. And having support for an owner's rep is so helpful, so that we, as leaders, can focus on the next strategic project, or making sure our staff are supported the way they need to be supported. That we're not in the field going, okay, the drawing says this. Why isn't this here? They're repping at our meetings and things like that. It allows us to lead as leaders and jump in if we're needed. And I still think an owner's rep is more cost effective than having more project management. More project managers to manage the projects is essential. We both need them, but we need owner's rep in the field, because our project managers can't be at all the projects at once.
Right.
Yeah. How's that soapbox? Was that a good soapbox?
That was a good. I'm in total sync with you today.
You guys definitely need to talk after this. It's good to know you can help each other a little bit.
Yeah.
I don't know if there's anything you guys have in mind for me to mention. I think we're good on time, so I might start wrapping up a little bit.
Okay.
Sure.
I've definitely learned a lot. Before coming in here, I had no idea, the ins and outs and all of the little nitpicky details that go into medical office. So it's been really great chatting. And thank you for joining us. I hope you guys have a lovely meeting after this.
We'll talk for hours.
Thank you for having us.
Yeah, thank you for having us.
It's
This was great.
Absolutely. Thank you.
Yeah.
Thank you so much for tuning in to Ciminelli Chats. Please be sure to be on the lookout for our next episode and check out our show notes. We'll see you next time.